Hey,
Nobody goes to
whatever
that
came
website.
of that response to that email?
He wants to be on the show.
Oh, nice.
Of course he does. That's what he was angling for. That's all he wanted.
He should have just asked.
I know.
I know.
Instead of writing a stupid email.
I agree.
What was his name?
Explosion.
All right, should we get going here?
Do it up.
Sure.
Okay. All right. Welcome to Buds with Suds. I am Richard Zombeck. Just a couple things, housekeeping things in the beginning here. You can hear us on iTunes, YouTube, Stitcher, Spotify. You can also listen to us on the website at www.budswithsuds.com. And there's a call-in number there for our voicemail if you want to hear yourself on the show and have us insult you, comment on your commentary, and whatever. So this is what are we looking at here, Dennis? The fifth round table?
Oh, I think we're higher than that.
Are we? 27th, maybe?
Yeah. Feels like it.
The
6 or 7, I would think.
Yeah, we get together every once in a while when something legitimate or illegitimate has happened, and this one is about the Governor Baker's Recovery Coach Commission, and I guess this is their final findings and recommendations.
The recommendations
right?
were submitted to the governor, and then it will be sent to the legislature if they, to then final. There might be some more recommendations added on top of.
All right. Well, before we get to that,
There may be some taken out.
Yeah,
I want
that too.
to introduce everyone and have you guys introduce yourselves because apparently I don't do that enough. So to my left, weighing in at about I'm kidding. Danny Ginnivan. Danny, why don't you tell us a little bit about you? Make it brief though. Don't we don't need from DNA on up.
Okay. All right. I'm Danny Ginnivan. I am the Director of Recovery Coach Services for Elliott Community Human Services, and I am also an emergency department recovery coach for the time being at Union Hospital and Salem Hospital.
Here at North Shore Medical Center. Yeah.
That's correct. When I get called.
And Katie O'Leary.
Hi, I'm Katie O'Leary. I'm the Director of Recovery Support Services for North Suffolk Mental Health.
And you've also been on the show. Danny's actually the only one here that hasn't been on the show. And next we have the man of the hour, the man with the power, always sweet but never sour.
Yeah. You're going to say my name? You said you were going to introduce me, and then I was going to introduce myself.
Dennis Doris.
All right, thank you. I'm Dennis Doris, certified recovery coach for Elliott and Lynn.
And certifiable.
Yes.
And I'm Richard Zombeck, the quote-unquote host of this show, also recovery coach supervisor at Partners, North Shore Medical Center, and North Shore Physicians Group in Salem and Lynn. So, all right, Danny, why don't you start us out? What do we got?
Well, you got all the credentials. I think the one that we've been most we've talked about the most is
This is for recovery coaching, and we're talking about the Recovery Coach Commission for Governor Baker, which we kind of got to at the beginning, and Dennis started going into it, and I interrupted him, and so that's where we're heading off to here.
Yeah, the commission made 11 recommendations. These recommendations aren't in law, and they're just recommendations. The governor and legislature can do with it what they please. They can take some of it and implement it into law, or they can take none of it, or they can take all of it. These are just recommendations that will then go to higher up the food chain in the state government of Massachusetts to then make decisions about recovery coaching.
And all the events leading up to this were listening sessions. How many? Do you remember how many listening sessions
They
there
had
were?
5.
And then multiple meetings that involved quote unquote consumers, right? People that had recovery coaches to help in their recovery. They had a panel of recovery coaches. They had a panel of supervisors and organizations that were
consumers, providers, employers.
Okay.
All that stuff.
All right. And then so they had those listening.
Correct.
We have
Those
2
panels.
people that were on panels
Yeah,
right after.
both Danny and Katie were on those panels. Katie, what were you there for? Were you
Just a recovery coach.
were there as a recovery coach, and
I
you
was.
you too, right, Danny?
No, I represented an employer.
Oh, you're representing an employer.
Yes.
Okay.
And my boss represented an employer with
Yeah,
Danny.
Kim, yeah.
And then Steve Lesnikoski, who's also been on this show, was
Was a
also
recovery
was a
coach
recovery
with me.
coach with
Yeah,
you.
sure.
Right, that's
That's
right.
right.
Okay. And then so I think the three of us, minus Katie, were at the last the last commission meeting where they kind of went over what they were looking at and where this was going, and that their recommendations were coming out. And then this came out, what, about a week and a half ago?
Friday.
Friday, yeah.
Was it Friday? Was it that?
Yeah, it came out like 5 o'clock on Friday. They did it like late because we were looking for it. We were expecting it, and we were at work. We checked at like 4. It still wasn't up, and then boom, at like 5 o'clock.
Last Friday, like a week ago tomorrow.
Correct, yeah.
Wow, we got to this pretty fast.
Yeah, you know.
Wow,
yeah.
good for us. Yay.
So,
All right. So what do you, Dennis? What are you thinking here? You mentioned something to me, either in a text or on the phone, that you and I kind of agreed that I think we got to like okay at least. But you had said what you said, which I found interesting, was there's something missing and you just can't put your.
Well, I
finger
said
on
it to Katie too.
Yeah.
I was like, there's 11. I'm like, I expected more. I said I don't. It just feels light, and like I don't know what is missing, like what they didn't put in there that we've probably talked about, but it did. It just felt light to me. And even some of the recommendations, I don't know if they did it on purpose, but they seem kind of like
Vague.
like open-ended, where maybe they're going to let the people that are going to put it into law, if they do, like,
Make some
yeah,
additional.
like they are going to, nail it down. But it seemed like, yes, vague and light to me. I mean, all the ones that are in there, I'm, for. Like, I agree with all that stuff that's in there. But, yeah, something felt like it wasn't in there. I don't know what, but
So my guess is you're probably talking more about specifically the commission should develop recommendations for a streamlined process
Yeah, it's
and
just-
adequate protections to ensure unauthorized individuals. So sort of the idea of licensing, and they didn't really go into that very
doesn't-
much.
yeah.
There's only one recommendation about it, and that there should be a state sanctioned process for suspending certifications and overseeing corrective action, and that the state should take that over.
yeah. And then even the recovery piece, the sustained recovery, they were going to like almost do a definition of what that was going to be. They didn't
2
really
years.
I know, but
2 years of
what
what?
does sustained recovery mean? That's what they were talking
So
about.
they didn't really define what
Was
recovery
what sustained
is.
recovery
But they
is.
did say that
The
sustained
the
would be
term
2 years.
Would be 2 years. They did say that, yes, but they did not define what
They
didn't go
consider
into.
recovery
Yes,
is.
so they didn't go down that road, which they said they were gonna, if I
They
remember
attempted
correctly.
to.
Yeah, but
Yeah. And
so
what
that-
happened?
I don't think they all agreed
They
on
probably
it.
all got scared, like who knows? Like, they probably realized what they were doing.
Well, if you look at what it says according to the Recovery Coach Academy curriculum, you're in recovery when you say you're in recovery.
Yeah.
Okay, so you can sit there and drool on yourself, and then you can help somebody else drool on themselves. I mean,
No, I mean this is kind of
Meet them where they're at, Katie.
Yeah, but this is what I don't get, right? Is that if they're going to talk about this, then they're going to make this a requirement and not leave it up to the individual organizations, right? How do you define?
But that's another thing they put in there. They said the organization has the right of like flexibility to hire somebody that doesn't have 2 years. So they put that in there,
Yeah, so and I am all for that.
Yeah, no, I'm
there are
not-
people that I have worked with, have hired that don't necessarily have that amount of time, but are stable enough in their recovery that I'm comfortable working with them and don't necessarily already have 2 years, that they can work towards that. What they say is that like that's just a benchmark, and it gives the employer the ability to say, we're going to work with that person till they get to the 2 year mark to then be able to get licensed. That's kind of how they talked about it. And it was set up as like, you can hire someone that has 18 months, but they can't get licensed for another 6.
I
But,
cannot,
Yeah.
You cannot. Why?
because the policies and protocols at North Suffolk are a minimum of 2 years of sustained recovery.
And what's sustained recovery for North Suffolk?
Does it say demonstrate it? Like, you know what I mean? Like, do they do anything to try to determine
I mean,
if that's where you're at?
Right now, are we going on anything more than feeling?
Then somebody's got no. I don't think there's any
Right.
test.
Yep.
There's
Right.
no
So
like.
how do you determine? I mean, and we can't really go into like starting to drug test people, right? Urine test unless you do the entire organization.
I mean,
right,
but
on
I
a
like to
regular
recruit
basis.
people, so I kind of go a little bit differently. Like, obviously, I take resumes and, but I also take people that I trust, suggestions and recommendations, and I'm very observant, and I watch people. in how they interact in their own personal recovery, whatever that may look like. And then I hire people or recruit them based off of what I see.
Right.
And if I like what I see, and I play towards people's strengths. So if I'm looking for somebody in the ED, I'm looking for someone with specific characteristics, because not everybody is built to handle that.
Okay, that's fine, Katie. But here's the thing, right? Is that's a great way, and I agree. I do the exact same thing, right? I'm not always right,
No.
but you can't standardize that.
No.
Right?
No,
and
no.
what right?
That's the problem.
Right. And this is the problem. This is what they're looking at, right? So they're
Yeah.
saying they want to make this so that you get credentialed, and part of that is 2 years of sustained recovery. And without defining what recovery is, right? We're kind of now what? So that's great. And
You leave a big hole in the floor.
well, and my guess is too is that nobody's going to want to address this because it's not politically correct to address that. So let me just bring up one point: is when Dennis and you and I talked about this right before the show. Dennis and I were at the last Recovery Coach Commission, and someone was talking about what do you do when recovery coaches relapse. And the whole conversation got sidetracked because apparently someone else on the panel got offended by the term relapse, and that we have to use the term recurrence
Reoccurrence.
or reoccurrence, right? Well, but this is the thing, right? This is and I did a show on Maureen Kavanaugh's show, which is unfortunately named
Collateral damage.
Collateral Damage. Thank you. And
I like the name.
we were talking about that. About we get bogged down in we get sidetracked on a 15-minute conversation for a 1-hour meeting about what words we're using, right? And we never actually get to the point because there's always someone in the room that's offended or is
yeah.
going to get pissed off about the rules that are coming down. And what I imagine this is going to look like is people are going to say, well, it needs 2 years of sustained recovery, and someone pipes up and then goes, that to me means abstinence, right? Complete abstinence. And then someone else is going to, what about someone on Suboxone? And they're right,
Yeah.
right? But this is not going to be an afternoon conversation.
No, it's not going to be an easy conversation. No.
Yeah, and
Well, because the way they have to define it, it has to be very black and white. They can't leave room for interpretation, and that's difficult. And it's a difficult conversation to have. I wouldn't want that responsibility to have.
I wouldn't want to be on that. I wouldn't
No
want to be
way.
anywhere near that room.
Well, yeah. Do you want to be on that board making a decision whether
No.
somebody's certification should be or licensure should be suspended based on something they may have done or not done?
Right.
or something they may or may not have ingested.
Right. Right.
Well, I think some of what they talked about was like the peer support model, like with the interview process, and that could be a way to gauge where somebody's at. I know you still can't prove, clean time, but it's a better way to judge maybe where they're.
You know that term "clean" is offensive too, because then you're insinuating that
the opposite's
the opposite
dirty.
is dirty.
I don't give.
All of it goes back to, it comes down to self-disclosure. If coaches don't want to, can disclose what they want and stuff, so that can be problematic. Of saying like 2 years, someone doesn't have to disclose everything about their personal life. Think about it in an interview. What are you able to ask and not ask based on HR guidelines? It's the ADA. You look at the ADA and whatnot. It's it's pretty difficult.
Well-
Until someone opens that up and says, "Yes, I do." This is what I.
Right, but they've pretty much put this in
Yeah.
that in order to be credentialed as a recovery coach, you have to have 2 years of sustained recovery. Right? Now, how do they start defining recovery, and what does that conversation look like? How long did this take to get here? Is it a year, a year
1
and a
year.
half?
1 year.
Has it been a year?
Just
And yeah,
about.
yeah, that's
So-
that's what the legislation.
October. They
August. They did August to August.
Yeah.
October was when they released the people that were going to be on the commission.
Yeah, maybe, but the bill was.
Yeah,
the bill was
July.
Yeah. So,
So-
yes, it's been a year.
Yeah.
So for credentialing, what do they come up with? They come required lived experience as a criteria to be a recovery coach.
Yeah.
Strengthen current credentialing processes, right?
Yep.
and developing a process for suspending certifications or overseeing corrective action,
Board of registration.
and adopt a state-sponsored credentialing process to improve transparent accountability for recovery coaches. Is there board of registration on there
Yeah, right now. Yeah.
under credentialing? I don't.
Number 4, the credentialing process should be overseen by a state-sponsored board of registration.
Okay. All right. Any thoughts?
I'm all for it. I'm very for the idea of the state stepping in and having some licensure. What Dr. Duckworth talked about on that is if the economy does kind of go downhill, third-party payers and insurance companies are going to look at, licensing and will legitimize.
It's a way to legitimize,
this and pay for recovery coach services even in a recession. Lots of places are paying for recovery coaching now, but not all commercial are yet, but they might if we start to show the
Some
evidence.
are starting to jump on board.
Some are starting to jump on board and realize that peer recovery, supports work, and what we do is different than a clinical role, and they're going to pay for it.
But they want a lot more
Yeah.
than the traditional mass health in terms of contracting. Like there's policies and procedures and stuff that they want in actual writing before they are willing to contract with you, and the amounts of stuff that they want you to provide for having recovery coach service. And that's not even how some of them define it. It's like peer support services, and it's actually under a different billing code than Mass Health, which makes it tremendously difficult for a billing department because that needs to be created from the ground up. So it's very, very overwhelming trying to partner or contract with commercial insurances.
And what are they requiring? I mean,
I'll pull up some of the policies.
Okay.
Prepared, I like it.
Keep talking. It's going to take me a minute.
I can always cut it.
Yeah, this said, the credentialing process should compare like the fees. We pay more than
In LI.
LISW, and like we pay more for our certification than peer support.
Way more.
And, yeah, like almost
I paid
double or something.
$100 for my LADAC.
Yeah.
I just paid $150 for my recert, and I paid $250 for the initial certification.
Yeah. And ours is what, $250 for
$250 for the certification.
cert, yeah,
$250
right?
for the
It's
certification.
$100 for a LADAC for 2 years, the same amount of CEUs. Well, for recert, you need the same amount.
Was it
Yeah.
32?
40.
Is it 40 for us?
30
What, for us?
30.
30 for
It's
us,
30 for
40
us.
for LADAC. So similar.
Yeah,
Okay.
close. Yeah, it's 30 for us though. Yeah.
And for an LI, it's 173.
That's the fee, right? And what's the peer?
Free.
Yeah, it's
DMH
free. Yeah,
DMH
so,
pays
yeah.
for that. They don't offer that as much. They offer it like 2 to 3 times a year that they sponsor the training
Yeah.
and the testing. So it's it's pretty much paid
What's
for
going
by
on
the
with the
state.
test? Has anybody heard anything about our test? No.
I haven't heard anything about the test. I haven't asked. Honestly, I don't even want to. I haven't even gone down that road. I'm still waiting for
right.
coaches to get back their certifications.
You got it, Katie?
Yep. So these are these are some of the ones that I can kind of wrap my head around. There is a policy and procedure about consumer rights, responsibilities, and ethics. Fair. There is a policy and procedure about confidentiality. There is a policy and procedure about family involvement and consumer care. There is a policy and procedure about consumer involvement in care and services. That's all, under ethics and responsibilities.
Yeah.
Makes perfect sense, right? Some of them are organizational or agency policies, like there is a policy about addressing safety and security. The agency is easily located and identifiable from the street. There is a comprehensive disaster plan.
Do they have anything specific about what they want you to do
As
with
far as recovery
the
coaching?
consumer?
The policy written criteria for initiation procedures of an inventory of consumer strengths and resiliency factors. The policy written criteria for initiation procedures includes a review of the consumer's family and support team. The policy written criteria for initiation procedures includes a review of whether the consumer has a RAP, Advanced Directive Recovery Plan, and or a plan for managing relapse, not reoccurrence.
So
The policy written criteria for obtaining appropriate consents to contact the consumer's behavioral health clinician, medical physician, whatever. There is a policy written criteria for the development of a recovery plan developed with the consumer. There is a policy written criteria for the review and update of the recovery plan at regular interviews. There is a quality improvement program. The program has a process in place in writing to ensure the availability of contact records to the peer, family, or coach. The program has a policy for making the contact record available for consumers upon request. It's just like the list goes on.
I mean, it sounds like they just want a wellness plan, but it's
No, but they want-
very lengthy.
There is
and
evidence
wordy.
of ongoing assessment of peer staff competency through performance evaluation and trainings, personnel files, including resume, background checks, job description, license, and annual evaluations. There is a specific policy written in addressing initial and ongoing training of peer support. There is a specific policy written criteria addressing staff supervision of peer support. Like peer support specialist job description listed and list essential knowledge and skills consistent with the work to be completed. There's like 35 of those.
So they're basically these are
This is from Optum. So Harvard Pilgrim,
so
always,
they all have their
UVH.
own, and they all have their individual requirements in order to start paying for recovery coaching, right? So yeah, so
That's just some of them. There were way more, but like they want all of those policies right in place before they will actually
Just
allow
to do
you
a
to
contract with you? Wow.
well, and here's the thing too: is that individual states can stipulate that as well. That insurance companies that should they want to do business in this state have to go by a certain guideline that the state provides, or they not provide insurance in the state.
But the definition is completely different.
Right,
So
but
if you
what
look
I'm saying
Mass
is that,
Health's
for example, the
definition-
state of Massachusetts could define and stipulate what insurance companies can require for paying for recovery coach services, right? So if an individual insurance company has something that's out of those guidelines that Massachusetts has put forward, they wouldn't be allowed to provide insurance for those services in Massachusetts.
Yep, and their rate's a lot different.
Nor would they get paid for it either.
So I
right?
think their rate is $16 per 15-minute unit. So they don't actually do the daily case rate. They're very similar to BSAS and their outpatient
They do
blanket
units.
contract.
Yeah, I do units.
But the going unit per unit rate is like $13.97 or $14.97. I'm not sure. It might have went up a little bit. It might be $14.97, but yeah, they start at $16.
I mean, what I'm concerned with is that, you know, the same thing that's happened for any kind of other services that were provided, right, around addictions and stuff like that, got bogged down with paperwork and this garbage of having to meet certain requirements and stuff, and that this whole movement, or whatever you want to call it, just crumbles under the weight of that.
See, my problem is in their definition. Their definition of, and it's not even they don't even call it a coach. It's like a recovery support specialist. And then in Mass Health's definition, complete opposites. They don't even look similar. So it's like really, really, really concerning. And they're allowed to define it however they want to define it. And like the organization I work for is not comfortable with their definition because it's not accurate of what we do for
we
work.
don't.
So they don't want to kind of sign off on that. Like, and, you know, pretty much what we were told, well, then you don't have to sign it. We have to offer it to you, but you don't necessarily have to add us to your contract if you don't want to. So
with the commission, right, and I was initially, let's say, uncomfortable with this commission being put together. Danny and Dennis, conversations with them both kind of led me in a different direction of becoming a little more comfortable with it, that there has to be some kind of oversight. Danny, what you had been talking about before we started recording too was the example of someone being completely against this. I can't exactly remember.
Phil Valentine.
Okay, so what was his take on that?
I mean, I can pull up his exact quote about licensure.
Who's he? The guy from CCAR?
Yeah.
All right here. Phil Valentine, executive director of the community CCAR, said that his group has trained more than 20,000 recovery coaches. Participants in his program do 60 hours in addition to professional recovery course. For the certified in Connecticut, prospective coaches must go an interview and review process. He doesn't support professional licensure because it puts the emphasis on more credentials and not experience and the ability to help people. People don't care how much you know until they know how much you care. That is the essence of recovery coaching. The coaches are similar to the alcohol counselors popular in the 70s. Most of them were recovering alcoholics, and over the years were pushed out of the treatment and recovery community as states began licensing counselors and setting requirements to work in the field. We rely far too much on people's credentials and not their experience and intuitive skills of being able to help another person.
Right, and we've talked about that on the show too, right? That whole idea that back in the 70s this started and then it just got bogged down again. So that there's you had also mentioned there was a quote from Governor Baker in there?
There was, but it's not about coaching.
Okay, so never mind.
So
Scratch that.
Oh, yeah, here it is. Baker, a former healthcare executive, says the lack of professional standards and regulatory oversight means many private insurers are unwilling to pay for coaches. That hurts recovering addicts' chances of staying clean, he said.
Right. So what we've got is a standoff. What we have is a standoff where we have the insurance companies who don't want to pay unless there's credentialing.
Yep.
And we have organizations or recovery coaches and recovery coach organizations who think that credentialing is going to ruin the recovery coach model.
All right, but isn't this an organization that will train anybody in anybody?
Yes, for the correct fee.
$750.
Anybody can become we'll train you.
We're talking about CCAR.
CCAR. We're talking about CCAR
Okay.
down in Connecticut.
Just so that we're clear.
And that guy you just quoted, they'll train anybody, and they can become a recovery coach. That's what they think. So they think their training is more important than the way. If you're trained, you can become a coach.
Okay, so let me run something by you guys then, okay? Because every once in a while I get the opportunity to go to North Shore Community College and sit in and speak at Michelle Simon's class. She's teaching her recovery coaching the two first 30 hours and second 30 hours. And I basically do a little spiel about who I am, what I do, and then it's basically Q&A, right? Which is mostly how I like to run presentations anyway. I don't like to give presentations, so I just assume this is who I am. Let's hear your questions. And one of the questions that comes up, recurring question that comes up is really around how are they expected to be when they're working in these situations, right? So there seems to be this kind of attitude that once I become a recovery coach and I'm trained as a recovery coach, I have to act and be a different way because Danny, you're shaking your head, but and I shook my head at that question too, right? But this is a recurring theme in these classes is you have people that are sitting there that have been doing this already for however many years, naturally and instinctively, right? And then you put them in a classroom setting and you feed them a bunch of lines about, again, I'm going to get hammered for this because I already have motivational interviewing and the Stanford experiment and all of this. And now they think that they have to act and be a different way in these settings. And in some cases they do, right? Because they're in a professional environment and they're in a hospital. However, the conversation is still the same as the conversation you're having out on the steps of an AA meeting with someone who's trying to get sober, right? But then you have people who are forcing this kind of fake professionalism into their daily lives in order to meet some imaginary requirement that the organization has of them when the whole idea that you were hired was because that didn't work up until now, so here we are with this.
Yeah, I mean, so I hear, I go back to one of my peer specialist trainers, Scott Francis, who talked about when he would, he dressed down intentionally, even though, and it could because he was able to relate more. People would relate more to him when he wasn't dressed up and like he would go to, thought he had to go to work initially with like dress shoes on and slacks and whatnot. And none of the people he worked with would ever trust him. And, he would ask what's going, and they pointed to like your shoes. I feel embarrassed when I'm sitting with you because I don't think you're a like-minded person, even though you identify as a person with lived experience. And they were, they felt like they were sitting with a clinician, even though he wasn't a clinician and whatnot. So he talked about how he had to change his attire to match, sort of working in the community and whatnot. And I encourage, I don't think you need to show up to work in a shirt and tie to be a recovery coach. In the ED, yeah, do you need to be a little bit more, do you need to wear closed-toed shoes and stuff like that? But, don't wear your pajamas to bed. But at the same time, when you're out in the community, you don't need to wear a 3-piece suit to work every day,
So I showed up to work as me. I'll give Sausage a shout out because he had my job before I did. And like, he's a very large guy. So for him, like showing up to work in work clothes, like he would have had to go out and buy an entire new wardrobe at like 2 years clean. And to find a suit in his size, Dennis, wouldn't you agree, would be rather difficult.
Yeah.
So, he went to my boss at the time and asked if he could like wear sweatpants and, and they kind of changed the attire based off of him. So, like, when I seen what he was wearing when I started, I was like, well, I'm going to dress down too. Like, but then again, like, I have to be cognizant of my environment and where I'm going. And, like, now, like, I don't worry so much about what they think of me or how people relate to me. I dress for the environment. So if I'm going into court, I'm going to dress professionally because I'm a role model. And if I dress professionally, hopefully, they can do the same thing. And if I'm going into the ED, I'm probably going to wear closed-toe shoes. And if I'm going into the House of Corrections, I'm probably going to wear something that's like, covered up and not so revealing. Obviously, they're not going to let you in dress like that anyways. But yeah, like there's days I go to work in my slippers and a sweatshirt and sweatpants and just like when I had hair like wrapped up on top of my head and I'd hibernate in my office and nobody would bother me. But then there's other days where I can be very professional and, kind of fake the funk. But people did relate to me more when I was wearing dressed down and wearing street clothes.
Right, and I think there's a bit of a push, and this is what I'm seeing with some of the questions and the people that are taking the classes that want to be recovery coaches are getting the sense that they're not going to be able to, for lack of a better term, be themselves, and that they're going to have to change their demeanor in order to work in a professional environment, right?
But you got hired to be you.
I understand that.
And that's on the organization.
I think that depends on where you work.
I completely agree with you. I mean, I definitely, I tend to wear button-down shirts and
That's you, though.
Yeah.
Well, I don't know if it is, right? I spent a lot of time in technology working in tech companies that if I looked like this, they would think I was looking for another job, right? And so I wore a lot of, cargo shorts and T-shirts with, stuff. And I started working in the hospitals and I went back to, the kind of clothes that I wear now. But I don't really find that puts a barrier between me or anyone. I spent a couple weeks in the ED, and it's like all I got to do is sit down and drop a couple F-bombs, and I'm in.
Golden.
And so it's not. I don't know that it's the way that you look, but it's certainly the way that you relate and that you talk to another individual, and that you show a little bit of. Someone said it, that you're showing a little bit of compassion. I think it was what you read. You're showing a little bit of compassion and some kindness. It doesn't matter necessarily what you look like. It matters what your story is and how you relate and how they relate to you, right? But we're getting bogged down in the credentialing and the licensing and the education around it. And I'm not saying that that's a mistake or that there's something wrong with that, but I think, going back to the quote that Danny read is putting too much importance on that is going to leave us in the same situation that we were when we started this in the 70s, with people doing this and then piling stuff on top of it in order for insurance companies to pay for it, right? And what I keep pushing, particularly my organization, about, because we own our own insurance company, for the love of God, right? If someone is going to start thinking and creating something out of the box, it should be a health organization that owns its own insurance company, right? That should be the place that really pushes and is a forerunner on this and saying, this is how we're doing it. Mass Health has surprised the hell out of me. Absolutely surprised the hell out of me that they pay for what they pay for, and that they're willing to take that extra step to they pay for 90 days of treatment, right?
More than that.
Yeah, but regardless of what that is, right? Whether it be IOP, recovery coaches, detox, whatever, they'll cover 90 days, right?
You just
Or
have to
like you
meet
said, more than
ASAM.
that.
You have to meet ASAM criteria for that level of care.
Yeah.
So you have to be able to justify it.
I found myself in the ED or with patients on the floors, and them kind of going, yeah, I have Mass Health. I don't know. I'm like, awesome.
Yeah, that's the gold standard.
That's terrific, because Blue Cross and other places aren't going to necessarily pay for what you need, but Mass Health will, and it'll pay for us too. So, that we have certain organizations in the state that are making the effort and seeing the value in this, right? And I think the more commercial insurance companies, because that's just the way they're built. They're not built to pay anything. They're built to make a profit, and they're going to make it as difficult as possible. And I think this is where the commission was lacking a little bit, is that it needed to look at, how do we pay these people? How do we get them paid? And that the legislature in Massachusetts is perfectly capable of creating guidelines for insurance companies to adhere to in order to even sell insurance in the state.
I think BSAS did a really good job of educating some of these organizations as well, and some of the insurance companies, as to like what a coach actually is and what a coach actually does and what they don't do. So I have to give Julia some credit where credit's due, because she actually has done a really, really good job when it comes to that.
So a little shout out to Julia.
Yeah. Hi, Julia.
So what I wanted to go back to when you talked about the class is
Danny.
like, the class talks, so this is another CCAR thing, because I get a lot of emails from them. They talk about the art versus the science of recovery coaching. The training teaches you all the stuff you need, in some of the science of recovery coaching, sort of like active listening, asking good questions, being aware of biases and managing those. What Phil talked about, and again, to summarize, the purpose of a week-long training is to enhance one's ability to care. That you can't. It's you're not going to learn how to recovery coach in 1 week, in a 1 week, 30-hour training. It's going to take work. Like, that's why you have the supervision. That's why you need that. It's gonna be hard. You're still going to learn. You're going to make a mistake. It's an art.
Can you really make a mistake when it's just all in God's hands, though, Danny?
Jeez.
I make mistakes every day.
Yeah.
That's how I learn, is from my coaches making mistakes, from myself making mistakes, from owning my mistakes. It's the only way you grow.
I hate insurance. That's all I know. I liked it better working without insurance. I know that's not realistic, but that's there's like one or two options. Either insurance companies change, which you would hope, but how realistic is that? From doing it the way they normally do business.
Well, there are other models.
We're gonna, do you think friggin' municipalities are really gonna pay for this? Like, no, that's not, they already went through all that, like with grants and all that, and it's not sustainable. No one's gonna pay $40,000 a year for a coach or $50,000 a year for,
Well,
Chelsea does.
Yeah, I know some places
But that's pretty
do.
much
But
it.
you're not going to get everybody.
Yeah,
to
but
No,
do
and that
that,
contract's not going to be around forever
Yeah,
either. At
exactly.
some point, it's going to dissolve.
But the organizations themselves can pay for them if they can validate that cost by offsetting other costs. right? Less ED visits, more PCP visits, more therapy visits, IOPs, detoxes, hospital beds, the stuff that the insurance companies do pay for, right? And you can offset that, those costs, or the cost of a recovery coach, by charging for those other services.
Well, yeah, larger organizations that have their own insurance, can do
Or
that.
that have their own ED.
Yeah, they're
or
Yeah,
their
they
own-
have their own
We don't
ED.
have an ED.
We don't- yeah.
Maybe your organization can, Richard, but and to
Poo-poo.
justify
Us little
it, but-
people?
Yeah.
Some organizations can.
Some, one or two.
Primarily yours.
Yeah.
One.
I think Leahy too.
I don't know.
Yeah, they
maybe.
probably could.
They probably
Yeah.
can too.
Leahy, I think, does the
Because
same
they also
thing.
have their own.
They have their own
hospitals
ED
and
in
things like
hospitals
that.
also. Yeah.
Correct.
No, I agree. I get it.
We're gonna go into the whole bit about supervision.
We can if you'd like. I think you do.
Yeah, I think it's pretty. I'd say it's job security.
Yeah.
one of the
I
recommendations.
don't agree with it.
There certainly weren't some people. Which part? What don't you agree
Well,
with?
let's,
I don't believe that a supervisor should have to take the RCA. That I do not agree
Oh
with at
well,
all.
The RCA?
then you don't like number 3 because here's the longer one. Recovery coach supervisors should be certified recovery coaches as part of their
Who's going to
qualifications.
supervise you?
I'm not a recovery coach. I'm a certified recovery coach.
okay. Hold. Let's back up.
So-
hold on.
God.
Let's back up and let's define what we're talking about here.
Yeah.
Read it, Danny. Go ahead.
So, recovery coach supervisors should be certified recovery coaches as part of their qualifications. So,
And this is one of the recommendations.
this is one of the
by
recommendations. So,
commission.
what I would say is anybody that's licensed has, their LI, right? So, once they get licensed, they still get supervision. It doesn't have to be by somebody licensed. They just, for them to continue having their LI, they just have to get CEUs, right?
That's not what that says, though.
No, but think about it. So for me to continue to get my keep my certification, all I have to do is get CEUs. So for anyone to continue to be licensed, they're just going to continue to have to get CEUs, just like any other profession.
Okay.
That's
They don't
how
have
I,
to be. They don't have to be working as a coach.
That's how I take it. So just
But
like
I do work in a coach as some capacity. So who's going to supervise me for that piece?
Who supervises you now?
Kim, but she don't have a car, and
clinical.
she's not going. No, she's not.
Oh, well, I meant.
And she's not going to go to a 5-day RCA, but she has more understanding of what pair work means than probably most people in the state, including most coaches.
so that and that
I just
was
don't
also,
like how they made it black and white.
Well, that was also brought up as that should be a lofty goal. That
Yeah,
the
'cause
way
they're gonna-
I took it and the way it was discussed was this is what we should strive for. That's not what it should be immediately. Like I don't think where the state is at that point where we could implement this right now is the only people that can supervise coaches are certified recovery coaches. There aren't enough of us. There's not enough people. But I think just like you have with any licensure, like to be licensed, you get supervision from someone else that's licensed.
BSAS already did it before these recommendations came out. You have to show them your RCA certificate to get into the supervisor's training now.
Okay, but you didn't when I did it.
Right, but you do now. They just started doing it.
Well,
so.
but
and they
wait-
did that before these came out.
Hold on, because this doesn't say that a supervisor has to be a certified recovery coach.
Number
Right?
3.
Yeah, I'm reading that. Right, current recovery coach supervisors take the Recovery Coach Academy and the Recovery Coach Supervision curriculum.
Read before
Right.
that though.
Oh, you're right. Recovery coach supervisors should be certified recovery coaches as part of their qualifications. Okay, so that I disagree with. I do agree that a recovery coach supervisor should have at least taken the Recovery Coach Academy and the Recovery Coach Supervision curriculum. I think it would behoove us that a recovery coach supervisor also be a certified recovery coach and has worked as a recovery coach.
And I think that's what they're looking for.
Yeah, but I agree with Katie too that it's an unfair. I think it's an unfair burden to put on an organization.
Like I said, I don't think we're there yet.
Yeah.
It's not possible right now. I don't think organizations have the infrastructure to do that or sustain the workforce there's not enough.
That's what they talked about at the last meeting.
There's not enough certified coaches to implement this, but this is what that the state should work towards in a further 10 years from now. To get your licensure, you should be supervised by someone that else is licensed. Like not tomorrow, not next week, but just like any licensed social worker to get licensed, they have to be supervised by someone else that's licensed, right?
Yeah.
So why shouldn't it be any other different for a recovery coach?
Well,
Because we're special.
And so I'm not saying it should be done
Fair enough.
tomorrow. I'm saying 10 years from now.
but Katie's not wrong. We're a non-clinical role, right? So why?
Okay, so why should
Why not have non-clinical supervision from
wouldn't
from
that make
peers?
more sense? You're advocating for
Point-
clinical supervision
Point
now?
taken.
Thank you.
No, I am not.
I know you're not.
Absolutely not.
I mean,
Like I said, that is a lofty goal to strive towards. It doesn't mean it's going to be there all the time, and it's not there yet.
I get that they're striving towards it. I still don't necessarily agree with all of it. I think that taking the RCA is a great first step. I think having somebody, like Richard said, have to get CARC certified, that's putting a large burden on an organization. We have the infrastructure to support that, and like I have 12 coaches, I have 5 supervisors.
Yeah.
So I mean, it is definitely feasible. Like we've been doing this for a long time. However, I just don't think it's realistic.
Well, and the thing is too is that if you've got certified coaches that are working as supervisors and they're also coaching, because presumably they would be, then like to Katie's point, then who's supervising them, right? I mean, we have three
director.
we have 3 supervisors sitting at this table right now,
Yep.
right? And there is no supervision for us in terms of like quote unquote clinical supervision about our job and the stresses of our job. I'm not talking about administrative supervision, right? I'm talking about, well, so here's the thing, right? Because my definition of what a recovery coach supervisor is may be very different from what your definitions are, right? And my definition is as a supportive role, right? There's no, at least in the role in the way we've defined it here, there's no administrative or punitive role on the recovery coach supervisor to the recovery coaches, right? So there's the supervision. What the supervision means is that I'm there as a supportive role, right, and to also work to a certain degree as a buffer between the clinical part of the hospital and the recovery coaches should there be an issue that would involve some kind of mediation or input from me, right? Whereas my direct boss is more responsible for the day-to-day administrative and things like that, right?
So, and I get what you're saying because I'm more of the administrative piece and I deal with like the corrective action and the day-to-day and like the administrative piece and the hiring and the firing and all of that. Whereas my supervisors deal with the day-to-day and the support of the coaches that they're working with. Now, I meet them at that level of like support. But like if there was ever to have to be corrective action or anything like that would also be my responsibility.
Right.
And I kind of do a little bit of both, depending on the roles and the settings. I do a lot of just supportive, not correct, and then I am, corrective action.
When it comes to Dennis, it's mostly corrective action.
Yeah, corrective action.
I don't really do much.
Approving days off and whatnot. Yes, I am. I handle that stuff for administrators. So it's kind of in between, and there's but I still get supervision for my recovery coaching that I do at my other job. I still have supervision every other week.
Right, but that's a unique case. I mean, you're already a unique case, but this is more of a unique case because you have that opportunity, right? That's afforded to you. right?
Well, and I think
because you're working two jobs.
Yes.
So you're working one job where you're a supervisor, and you're working another job where you're a recovery coach, and you're supervised by a recovery coach supervisor.
well, yeah,
Right? But that's not the case for everyone.
if
right?
you're doing coaching or you're working, you should be getting. I think you should be getting supervision.
Well, you wouldn't be a coach if you're not getting supervision.
I don't disagree with that.
According to BSAS.
I'm just saying that they, I don't know that they spent a lot of time defining exactly, either BSAS didn't and this board certainly didn't spend a lot of time defining what a recovery coach supervisor is and what the role of that recovery coach supervisor is, because
Well-
just the simple term supervisor in there makes it very confusing.
According
as
to them, they were not the Recovery Coach Supervisors Commission.
Right. Well,
They were the Recovery Coach Commission.
so, we stumbled across another thing that they may have missed.
I mean,
Not according to them.
I'm not willing to die on the hill fighting for like the cock being a requirement, but I think the RCA
No.
should be a requirement for
I- you know,
supervisors.
I'm-
And so does a BSAS. They've already done it.
I'm not like I've been supervised by clinical staff. I get it. I'm not totally against this, but I do think that should be a goal to work towards. Let's just
But you work in a clinical environment, and so don't I. And I have the option to get clinical supervision if I need it. And so don't all of my coaches. However, no one really utilizes it unless it's like absolutely necessary and there's like some overbearing trauma that happens or crisis. And then we look to the clinical team for support because that's what they're trained for. That's what they specialize in.
What else do we got? Anything good?
Richard's thinking.
I can hear it.
Well, so here's the thing, because we're getting close to an hour here, and I was looking through this, right? So let's just look at additional recommendations regarding. I'm sorry, the number 7 is the one that I wanted to look at, because that's a good example of, I think, of where we are in this process. Okay, so this is what it says. There should be a state-sanctioned process for suspending certifications or overseeing corrective action when a recovery coach does not sustain recovery or violates the code of ethics. Okay, now my problem, and what I think number 7 here makes very clear, is after a year of a recovery coach commission put together by Governor Baker and effectuated by Mary Lou Sutter and a panel of a bunch of people from different ranges and backgrounds.
I can tell you think highly of them.
And professional areas and panels and listening sessions, is I'm looking at these recommendations, and I am not entirely certain that we're any closer to a resolution than we were a year ago.
Well, and whose code of ethics are you using?
This is exactly what I'm talking about, right? So
The Jedis.
violates the code of ethics and does not sustain recovery, but we haven't defined the code of ethics or what recovery is. So how much closer to anything are we a year later after going to these things?
A lot of bark with no bite.
And paying $42 for parking.
I parked at the State House
Right.
for free.
But
Oh.
no, I mean, seriously, it's like, I mean, where are we in this process?
Lived experience is a requirement. That's about it.
Is that
What
it?
is lived experience?
I know, but
And-
that's
yeah, but
that's
this-
like that's how far we've come with it, basically.
But this is the thing, right? And this is one of those things like, well, let's put a show together and talk about this stuff and what happened at the commission, and we'd like to wrap it up and resolve it at the end of the show. But there's really, essentially, as far as I can see, nothing to resolve, because nothing has really been decided.
There's not a ton of substance. Like I said, they're light.
What's
they are
going to be
definitely
decided is there's going to be a board of registration. That board of registration is going to make the determinations on this stuff. So what's going to happen is that
Years down the line.
that board is going to have to is going to hear from us and hear from people that have opinions about things.
But they did this for the last year.
Okay, but
This
that
is
was
what they did.
recommendations.
Now it's got to go to law.
Now it's got to go into law for it to be created. So they heard from the public. The public wants this, right? So They want a border registration. Those are the recommendations.
Danny, you're so fucking optimistic all the time.
I'm sorry, but
Danny really is. He's Professor Positive, and it's annoying.
so they're going to make these recommendations. The governor the governor already has said, this is what I want. So they gave him what he wanted. Now he's going to say, all right, do it. And then how are they going to choose those people on the border registration? Who is it going to be? And hopefully
A bunch of clinicians.
yeah, hopefully it's people who understand recovery coaching, what it is. I don't know. Hopefully Julia is in charge of it. That would be my hope, because then, she understands this and has championed it from the start in Massachusetts. She's been one of the, people that has developed this curriculum for the state, and, who else is going to oversee it? I don't know. I mean, who oversees, does DPH oversee, any other boards?
Kiss the ring.
I knew something was coming.
I know. We'll be on a plane, and it'll be like the plane's going down. Plane's going down. We're all going to die. And Danny's going, well, there's a good chance we might land in water.
Right. Put your air mask on. That's right.
I mean, but this is the thing that frustrates me about this, right? Is you take a perfectly good model of something that's working and is basically relies on other people who are working in it and their gut instinct, right, which has been going along just fine, and everything's moving along, and you throw maybe some ethics at it, which basically is don't sleep with the people you're treating, right? That's
for how long?
Pretty much the ethical standard, and don't steal money and stuff that we should just basically know as decent human beings, right? And then you go, here you go, here's a bunch of alcoholics and addicts, and do what you do best, right? And then we start throwing stuff at it like boards and panels and commissions so that someone can get their nut in it, like the $250 a year or whatever that's going to be, and what licensing is going to cost, and how the insurance companies are going to pay for it, when you can pretty much mandate the insurance companies, if you want them to be able to sell insurance in this state, you put a law together that makes this happen, and you start maybe watching this work instead of,
That'll be the next commission.
Let's see how we can destroy this in as little time as possible.
How much money the insurance lobby has?
And how much money we can throw at this commission to meet, what was it, once a month or once every 2 months?
Like once every,
for
2 months,
for 2 hours, and talk about nothing except for what someone wants to raise their hand about that they're offended by because someone used the term relapse.
I think they had some decent conversations, though.
They look,
did.
I'm not saying they didn't have some decent conversations, but the end result is this, right? Is that, okay, so let's look at it again. Recovery coaches have to have sustained recoveries and don't violate the code of ethics, but we don't define what the code of ethics is, and we don't define what sustained recovery is. So where are we? We're no closer to anything than we were a year ago.
Well, I mean, we could just use.
Here we go. We're going to have the positive aspect.
Ethical guidelines for delivery of peer-based recovery support services, written by William White. Maybe we'd use that 52-page
That's
paper.
something they should have.
Well, yeah, of course.
How many pages?
52. Oh yeah.
But this is what I'm talking
That's
about, right?
nonsense.
So this has been done, right? There are other states that have done this.
there's other states doing this.
There are
Philadelphia.
20
We aren't
states. There are 20
recreating
states,
the wheel.
There are 20 states that are doing this, and yet we're talking about this for a year and coming up with absolutely nothing when we could just go, let's see what Philadelphia did.
Yeah,
for example.
I said that also about
Their peer code of ethics is pretty well
This,
written.
the Massachusetts one is really good. I'm a big fan. I utilize it all the time.
I'm sure you are. There are very few things you're not a fan of. Danny, Professor Positive Ginnivan. What do you think? Should we wrap this up? Should
Dennis, you've been really quiet.
Should we say goodbye?
I'm good. I didn't have a
Being
lot to
careful
say.
today?
No, I'm all right. What did we go through all of them?
I think we did, didn't we?
The self-care piece. We didn't talk about that very much.
Do you want to talk about self-care, Danny?
I mean, I'm all about self-care. I'm all about modeling, recovery and self-care for my employees and people I supervise.
All right, you stopped.
Should we wrap this?
Yeah.
We're looking for more than one, aren't we?
I guess we're going to say goodbye,
I
right?
just lost one.
Bye.
Had him hired.
I'm Dennis Doris. Bye.
All right, don't forget to listen to us on iTunes, Stitcher, Spotify, and YouTube. You can also catch us on the website at budswithsuds.com. And if you want to call in, leave a message, the number is on the website.